Hi, my name is Dr. Rudra Mohan, and today we're going to be watching a video of surgical extraction of two teeth, the lower right first molar and the upper left wisdom tooth, that is the third molar. Here you can see we are giving the inferior alveolar nerve block and some field blocks infiltrations so that we can anesthetize the tooth and the patient can be comfortable during the procedure. Mind you, during the procedure the patient does not feel any pain, the patient just feels pressure and movements, but in anxious patients even pressure feels like pain, and also sometimes in patients who have infectious teeth or infected teeth, there the anesthesia might not work. So now what we're doing is we're using a periosteal elevator to separate the gingival fibers, the gum fibers, the periodontal fibers rather, from the attachment of the tooth, and making sure that we can use a wedge and a lever principle to make the tooth mobile and we can take it out. Now you have to understand that this is not as easy or as simple as it looks, because all extractions can become complicated extractions because of various reasons. Now in such cases where you have the wisdom tooth, generally the upper wisdom tooth extraction is much easier than the lower wisdom tooth extraction, and here you can see that the tooth was rotten and there was a cavity, and we don't do any endodontic treatment generally in third molars. Now the first part and the first tooth that was extracted, we had extracted the first half of the root, as in one half of the root, and now in order for us to take out the other half which is submerged in the bone, we are creating a purchase point. Now a purchase point is a point that is created by a drill, and we can therefore use that purchase point as a fulcrum or as a wedge, and where we can wedge the instrument and we can use a lever principle so that we can use the elevator to luxate the tooth. By luxating, it means we are moving the tooth to take the tooth out easily. Because of the fact that the tooth was very rotten, it was very broken down, you cannot get a firm grasp with just forceps, or you cannot just use the elevator to luxate the tooth directly, because the tooth was so decayed, it generally tends to fragment away and break away. As you can see in the following images, that we are trying to shimmy the tooth out, and there's a high likely chance that in such cases of decayed teeth and grossly decayed teeth, that the tooth might fracture while you are trying to shimmy it out of the socket. As you can see, we are still trying to shimmy the tooth out and luxate the tooth out, and you can see that there is a broken fragment that has come out because of the gross decay of the tooth. Mind you, at this time the patient is not feeling any sort of pain, the patient is only feeling pressure, and we are following all the surgical protocols as much as possible for extracting this tooth. Now we are trying to shimmy out the last part of the tooth, this part of the tooth, and this is known as the distal root. As you can again see that the tooth is getting fractured because of its decayed portion. It becomes brittle after it becomes rotten. So we have luxated the tooth, and now we're using another elevator so we can take out the last remaining portion of the tooth, and the tooth is already, as you can see in the pictures, that it is getting mobile. The tooth is already mobile. And this is our team, Dr. Prabodh Sen and me, yours truly. I'm assisting in the procedure, and we're making sure that the patient is as comfortable as possible. Thank you for watching.